Why do I have sudden back pain? Sudden back pain can be alarming, especially when it appears out of nowhere. This type of pain can vary from mild discomfort to intense, debilitating agony. It's important to understand the potential causes behind sudden back pain, as they can range from benign muscle strains to more serious underlying health conditions. This article outlines some common reasons why you might experience sudden back pain and offers insight into when you should seek medical attention. 1. Muscle or ligament strain. The most common cause of sudden back pain is a muscle or ligament strain. This can occur after lifting a heavy object, twisting your back awkwardly, or sudden movements that put stress on your back muscles and ligaments. These strains often happen without warning and can cause immediate, sharp pain. The pain is typically localized to the area of the strain and can worsen with movement, but it usually improves with rest, ice, and over-the-counter pain relievers. Key symptoms: pain after activity, muscle stiffness, localized pain that worsens with movement. Treatment: rest, ice or heat therapy, stretching, over-the-counter pain medications. 2. Herniated or bulging disc. A herniated or bulging disc occurs when the soft, gel-like center of a spinal disc pushes through a tear or weak spot in the outer disc layer. This can put pressure on nearby nerves, causing sudden and sharp back pain. This condition is common in the lower back and can be triggered by heavy lifting or an awkward movement. A herniated disc can also cause radiating pain down your legs, known as sciatica, along with numbness or tingling. While a herniated disc can occur gradually, sometimes the pain comes on suddenly, especially after an activity that strains the spine. Key symptoms: sudden, sharp pain in the lower back, radiating pain down the leg, sciatica, numbness or tingling in the legs or feet. Treatment: rest, physical therapy, over-the-counter pain medications, and, in severe cases, surgery. 3. Spinal stenosis. Spinal stenosis refers to the narrowing of the spaces within the spine, which can put pressure on the spinal cord or nerves. Though spinal stenosis often develops over time, it can cause sudden back pain or discomfort if the pressure on the nerves becomes more pronounced due to activities like bending, walking, or standing for long periods. Key symptoms: back pain that worsens with walking or standing, numbness or weakness in the legs, tingling sensations. Treatment: physical therapy, pain relief medications, corticosteroid injections, or surgery in severe cases for kidney stones or kidney infections. Sometimes, sudden back pain may not be related to the spine at all. Conditions affecting the kidneys, such as kidney stones or infections, can cause severe pain in the lower back. Kidney stones occur when minerals in the urine crystallize and form hard deposits. These stones can cause sharp, severe pain when they move or block the urinary tract. A kidney infection, on the other hand, can result from untreated urinary tract infections and cause pain in the back, usually accompanied by fever, chills, and a frequent need to urinate. Key symptoms: sudden, sharp pain in the lower back, pain when urinating, fever, nausea, or blood in urine. Treatment: for kidney stones, drinking plenty of water and medication to help pass the stones may be recommended. Severe cases may require surgery. Kidney infections are treated with antibiotics. 5. Poor posture. Another common, yet often overlooked, cause of sudden back pain is poor posture. Sitting or standing with poor posture, such as slouching or rounding your back, puts an undue stress on the spine and surrounding muscles. Over time, this can lead to pain or discomfort that comes on suddenly when standing or moving after long periods of poor posture. Key symptoms: dull, aching pain in the lower back or upper back, stiffness, discomfort after sitting or standing for extended periods. Treatment: correcting posture, exercises to strengthen back muscles, ergonomic adjustments in the workplace. 6. Osteoarthritis. Osteoarthritis, a degenerative joint disease, occurs when the cartilage that cushions the joints in the spine begins to break down. This condition typically develops over time, but can suddenly flare up, causing back pain and stiffness. As the condition progresses, it can cause inflammation, which leads to pain and discomfort, particularly after periods of inactivity or prolonged standing. Key symptoms: chronic back pain, stiffness, pain that worsens with movement or after periods of inactivity. Treatment: anti-inflammatory medications, physical therapy, and lifestyle changes like weight management. 7. Infection or tumors. In rare cases, sudden back pain may be caused by an infection in the spine or a tumor pressing against the spinal cord. Spinal infections are usually accompanied by fever, while tumors may lead to persistent, unexplained pain. These are serious conditions that require immediate medical attention and are often diagnosed through imaging tests. Key symptoms: persistent pain, fever, unexplained weight loss, or neurological symptoms, numbness, weakness. Treatment: antibiotics for infections or surgery and radiation for tumors, depending on the diagnosis, and to seek medical attention. If your sudden back pain is accompanied by any of the following, it's important to seek medical help. Pain that persists for more than a few days or doesn't improve with rest. Numbness, tingling, or weakness in the legs, loss of bladder or bowel control. Pain that radiates down one or both legs, especially if it extends below the knee. Fever, weight loss, or a history of cancer.